most of the nearly 300 confirmed cases are at hospitals here in Wuhan.
There is heightened concern all across the world, including here at the U.S.
Officials here in Wuhan have designated 9 hospitals as treatment centers, including this one right behind me.
All eyes are on a new strain of a coronavirus.
Tests have shown that patients were infected with a novel coronavirus. These viruses are very common in animals. They live and spread in pigs, domestic and wild birds, dogs, cats and camels. For some reasons that we don't yet understand, the virus mutates and makes the leap from animals into humans.
In China, where the most cases are, it's older people who are ending up in hospital with this. They're usually over 40, and the very youngest person diagnosed is about 13 or 14 years old. So it doesn't appear to be affecting small children, and those who've died tend actually to have underlying conditions, as they say. They're frail, they may have heart disease or cancer already, and so they're vulnerable. Basically, their immune systems are not very robust.
The means of transmission is not yet fully understood, but some evidence indicate the following. Droplets from the patient during sneezing or coughing. Touching the patient's stuff or surfaces and objects contaminated with the virus. Direct contact with the infected person. The possibility of transmission from infected animals. The main signs and symptoms for corona infection are fever, cough, sore throat, shortness of breath, and in some cases, diarrhea and vomiting. For your protection, you should follow this advice. Wash your hands well and continually with water and soap or with other disinfectants, especially after coughing, sneezing, and using toilets. Use a handkerchief when coughing or sneezing and cover your mouth and nose with it. Then get rid of the handkerchief in a wastebasket. Try as much as possible to avoid touching the eyes, nose, and mouth. Put on face masks if you're sick, visiting sick patients, or when traveling to crowded places.